Welcome to Sensible Health Solutions, the show where we simplify health and wellness. Join your hosts, Hallie Fields and Dr. Scott Luper, as they share practical tips and expert insight to help you navigate common ailments, nutrition, and overall well-being. Tune in for straightforward advice that empowers you to live a healthier life.
Hello.
Hi, Dr. Luper. How are you?
Doing great.
Good.
Feeling good.
Good.
So I'm worried about my patients with liver problems. And one of the things I want to talk about at some point, but we should probably just do it today, is to talk about how to figure out if somebody's having liver problems and what to do about it. We've been doing these tests, not this show on tests, the whole month. Why don't we talk about liver enzymes?
Yeah, I think that's a good direction to take it. And so, why are you testing for liver enzymes? What are the importance of liver enzymes, the function, and what do you do to fix them?
Okay, sounds good. That's the whole show right there.
Okay.
So we'll start off with why even bother checking, because the liver's important. The liver does a lot of things to help us. I can't go, it's only a half-hour show because we got to talk all the things that the liver does. But the big picture things the liver does is it finishes the process of digestion. Our intestines break food down into its building blocks. It gets absorbed by the lining of the digestive system. It gets funneled directly to the liver. That is the first stop on the pathway to the rest of the body. You got to go into and through the liver first. And so the liver takes these partially digested bits of this and that, and then decides what to do with them.
And filters out the toxins.
Sifts it out. Yeah, and then the thing is about the digestive system, it's not all good news coming from the digestive system. A lot of times people have undigested food that makes it through their digestive system. You know, you eat a hamburger and you wolf it down and you're super hungry and you bite, chew, swallow, right?
Yeah.
And so you got these hunks and chunks coming down in your digestive system. And if you're, a 22-year-old male at the peak of your digestive ability, you might be able to get through all this stuff. But, if you're anything other than that, there's a real good chance that the food's going to be undigested, at least a portion of it, a percentage of it's going to be undigested. And that gets to your lower intestine. And the organisms that specialize in undigested food, these are organisms that rot food, by the way. They live in us. They prosper. And so what they do is, of course they do this is common sense, they take what they want, they use it, and they poop out what they don't want.
Yeah.
Except for out is not exactly the right word because there's no out about it.
Because it's
still
all in.
For sure.
But they excrete, and then you absorb the excretion, and then that goes to your liver?
You don't absorb all the excretion, only some. And it goes to your liver.
Okay.
And so your liver has to process these toxins. Toxins is a great way to say it. It's a great word, but really what it is microscopic poop mostly.
Okay.
And so your liver has to deal with whatever this is. And if the amount of toxins and irritation, infection, things like that come in too hot and heavy, it damages the liver. And the liver, the cells will start to leak or even die. And if that happens, the guts inside the cells come into the bloodstream, and whatever those are, those levels go up. And so you see more of that. So a good reason to check liver enzymes is because liver enzymes are common to liver cells, and if they go up, we can see that the liver cells are being damaged. They're becoming leaky at best, dead at worst. And so that's useful information to have. It turns out to be absolutely vital to have a liver that functions. If you don't have a functional liver, you can't stay alive. You just can't live. It's not compatible with life. Your body needs to be able to absorb nutrients and then process them to be able to live. Otherwise you starve. And you need to be able to clean your blood. Otherwise you starve. And you need to be able to make blood. If your bone marrow fails for whatever reason, the liver itself can pick up some of the slack on that and make blood. There's all kinds of things that the liver can do. Processing hormones is one of the jobs it does, a super important job. And so it's absolutely vital to have a healthy liver.
So when you're testing, you test the liver enzymes, and that indicates how healthy the liver is
Yep.
and how well it's functioning,
Yep.
processing all those hormones and
Yep.
processing all those toxins. So
It's not definitive. Basically, we're just noticing, because there's a zillion tests we could run, but we're trying to do this in a way that's affordable. You know, you want to run $5,000 every time you run a test, right? So what you're going to do is you're going to pick things that are going to be markers to see if there is a problem. If these 3 markers come out normal, chances are the liver's working okay. At least in a big picture way, it's working okay. And if they're broken, then we could think of other tests depending on what the situation is that we can run to shed some light on why the liver would be failing. Is the liver leaky or not? That's the big picture.
And how do you tell if it's leaky or not?
By running 3 tests. There's a test called an ALT, a test called an AST, and a test called a GGT. The ALT is alanine aminotransferase. The AST is aspartate aminoaspartase, and the GGT is glutamyl transferase, gamma glutamyl transferase. Now those big words, we're never going to say them again.
No.
I don't even think in those words. I have to look those up every time I think of them, because I never think of those long words. I always shorten it down to an AST, an ALT, and a GGT. That's what we really call them.
Those 3 tests, what do they each indicate?
So they each one in their own way are indicating how leaky the liver is.
Okay.
And so if the liver is being damaged, then those numbers will go up. Normally they'll run 20, 20, and 15.
20, 20, and 50. What are some of the symptoms that a patient will come to you that leads you down to wanting to test those levels?
Yeah, mostly what they'll feel is tired. That will happen. If it's bad enough and the liver's swollen and backed up, bile doesn't flow through the liver correctly, and so what they'll get is jaundice. So jaundice is a thing that we'll see with the liver is
Well,
damaged.
we see that with babies. We see that with newborns.
The cause is different. It's not that their livers aren't working well. What happens is they have too much blood, and the blood all breaks at the same time, and because it's getting remodeled, and when blood breaks, it releases bilirubin.
Yes.
And the bilirubin backs up, and so they turn yellow. And so if you get light shining on them, you can get the bilirubin broken down, and they do better. Because too much bilirubin can actually make them sick and could damage their liver and cause the liver to go into failure. Doesn't happen very often, but heaven forbid it was to happen on a little newborn baby.
Yeah,
No.
of course.
We don't want that to happen. For most people, what we want to do, actually, if you think about most doctors, what you want to see is if there's an infection in the liver. If people's livers have hepatitis, like hepatitis A or hepatitis B or hepatitis C, then the liver enzymes tend to go up, more or less, depending on what kind of hepatitis you have. If there's some sort of toxicity that's coming in hot and heavy from infections, or from, I don't know, eating things that are bad in some way. I mean, mushrooms is a classic example. You eat poisonous mushrooms, your liver enzymes will go up. So liver enzymes can go up a little bit. You can go from a 20 to a 40 to a 60 to a 100, right? And those are noteworthy changes, but they're really rather mild. You can go from 100 to 200 to 300 to 400. That's bigger changes. Now you're moving into hepatitis. You can move them into 1,000 to 2,000. That's when your liver's failing. And you're getting really big numbers. I've seen those a few times in people who had viral hepatitis, hot and heavy.
Wow.
And that's a life-threatening situation.
Okay.
Now, it's the interesting thing about the liver is the liver can take a lot of punishment and then recover from it. Amazing amount of punishment.
Right. It's filtering all of this nasty gunk out of our bodies all the time.
It's amazingly effective. The liver is the hottest part of your whole body. Tends to run around 104, 105. Isn't that interesting?
That is.
Warmer than everything else.
Yeah, warmer than our
heat,
internal body temperature as a whole.
A lot of your internal heat comes from your liver.
Huh.
Because it's so metabolically active.
Wow.
And it also has an amazing capacity to heal. It's one of the few parts of your body that if you lost 90% of it, could grow back.
Oh.
Amazing,
wow,
isn't it?
Yeah.
That's a big recovery.
I knew that you could live off of one kidney.
Yeah, you could live off a tenth of a liver.
Yeah. Oh, interesting.
Well, not well. I don't recommend it.
Yeah, not, living life to the fullest. But.
So here's the dealio. Most people aren't dying of hepatitis, right?
Yeah.
And they're living their lives, doing the best they can, and they come in and you just want to get checked out. They're tired, or they have headaches, or they have stomach problems, or they have a rash, or something like that. And all of those things could be affected by the liver.
But all of those things seem like such common ailments. So is there anything in particular that makes you want to take a look at the liver?
Yeah.
In association to like other things or other tests that they ran and that give you indication that there might be something more.
Well, any of those things I just mentioned, tiredness,
Yeah.
headaches, rash, digestive problems, I could add to the list. I could say bad periods, super crampy, joint pain, heart beat irregularities, otherwise known as palpitations.
Yeah.
I mean, any one of these things could be associated.
Everything is connected to everything.
Yeah, it's like that. So yeah,
Okay.
I just want to see them. So every time I run a normal blood test, these liver enzymes are included.
Okay.
They're just a standard inclusion. Now for us, we add one. Normally it's just the AST and the ALT. We add the GGT. The reason why we add the GGT because it's particularly sensitive to alcohol. So of the three, the one that's most sensitive to alcohol is the GGT. So if that one goes elevated, remember I said it's 20, 20, and 15. 15 is the GGT. So if the GGT goes up to 30 or 40 or 50, the first question I ask is, how much alcohol do you drink? Remember, they've already asked that question.
Yeah.
But I'll try to think, what did they tell me?
Right.
Or if I forgot to ask or something, then I want to know exactly, because that one will go up. It's super sensitive to it. And a lot of times you'll find people, they don't necessarily want to tell you how much alcohol they drink. And then it's like, well, I know you got to be guzzling here because these numbers are way too high.
Okay, so what makes...
I mean, I don't necessarily say it like that.
Yeah,
that's not
of
a nice
course,
way to say
Of course, in a more
But in my mind.
sensitive manner, okay. But what about the alcohol affects the GDT in that way?
You know, here's a good question. It's what happens is alcohol damages liver cells.
Uh-huh.
And the liver cell is particularly leaky to the enzyme GDT. And so when the liver cells gets leaky, it doesn't get, holes don't get punched in it, and they just start pouring out what's possible. Mostly what happens is there's a certain kind of stuff going in the cell and stuff coming out of the cell. Blobs coming in, because remember, amino acids are coming in, sugars are coming in, fats are coming in, there's all kinds of stuff that's coming in. And so these things get absorbed wholesale, and they occasionally get blobbed back out. I mean, cholesterol gets packaged up and sent off in these little packages. Blobs coming in, blobs going out. There's an economy. There's this turnover. And so if the economy is running hot and heavy, then the cells, even though they're not dead, they just tend to leak. There's this little stuff starts leaking out the cracks. Alcohol changes the permeability of the membranes in such a way that the GDT leaks out. So there's that. It damages the membranes that are holding the cells together. Now, if you pause for a moment and think a little bit, okay, so we were talking about damage to the cell. What about livers that are just kind of underperforming?
Yeah.
They're just not really doing much. I mean, they're doing their job, but they're just doing the basics. They're not particularly active. They're not particularly warm. They're not particularly, dynamic. They're just kind of phoning it in. Mm-hmm. What about those people? And the answer is you can tell. You can run the enzymes. You can see that too. What you see is low enzymes. Now, this one's interesting because normal doctors don't care. They don't notice. They don't follow it. It doesn't mean anything. It's not associated with hepatitis. And so your liver's fine.
Okay.
But your liver's not. What it is associated with is a slow liver. Now, if you had a slow liver, what do you think you'd have? Your vitality would be lower.
Right. You'd be more fatigued. You wouldn't be processing your hormones.
Yeah, there it is.
Yeah.
Bingo. You hit the nail right on the head. It's the hormones that show up. Mm-hmm. What you have is hard periods.
Okay.
Or weird periods.
Okay.
Somehow things are gone wrong with your periods. That's what it shows
Irregular
up as.
And all the crazy that comes
PMS.
from that. Mm-hmm. The mental.
Yes. And breast tenderness.
Mm-hmm.
So if you get breast tenderness before you get a period, chances are your liver's running slow.
Okay.
If you get PMS before period, chances are your liver is running slow.
Okay.
Not fast, not toxed out beyond reason. It's running slow.
It's just the body is using the blood in different areas. It's not using it so much in the liver as it is maybe something else that's going on.
Yeah, and also I'm not exactly sure. These are good questions you're asking. What's the cause of this thing? I'm not exactly sure. I know the pattern. I've seen it more times than I can count. I don't know exactly why the liver runs slow. It may be that it's just a reflex, that there's some kind of low-grade infection coming in from the digestive system, and the liver can just figure out kind of how to hide, not take a lot of
Behind the
hit.
scenes.
Yeah, and just kind of let stuff go by. And so it's possible that may be what's going on. It's not just PMS, though. I also want to mention that if you're having a hard time with your menses, with your menopause, where you have sleeplessness and hot flashes and all these other kinds of symptoms associated with menopause, these women have the same kind of thing, where the liver is underperforming.
Okay.
So if you can stimulate the liver to perform better,
Yeah.
you can get these symptoms to go down.
How do you encourage it?
That's a good question. Encouraging is one thing. That's harder. The better way to fix this, I think, is not thinking how can I encourage the liver, but how can I make the job easier on the liver. And so the first thing I would do is look at your diet. If your diet's crap, your liver's going to do too much work. So what you want to do is you want to clean up your diet. That's the first step. Step number one.
Okay.
Yeah, like that.
Okay, so
that I would start
after
there.
you clean up your diet,
Okay, so then what I would
and
do
you're
is I would
getting a
search.
solid 9
The thing
hours
I
of
would
sleep.
step one for me, I would search for infections, because we talked about infections coming from the stuff that you don't eat.
Yeah.
Well, I'm going to immediately jump into what infections.
Yeah.
I want to know what's growing inside you. Is it Prevotella? Is it a weird kind of E. coli?
Is it
a strep
staph?
infection?
Is it
Whatever,
strep?
something like that. Yeah, I want to know exactly what the infection is so we can treat it and clear it from your system. That'll make life easier on your liver. So that would be the next thing that I do. The next thing after that I would do is try to figure out anything in general that's kind of irritating, like alcohol or medications or recreational drugs or those things like that, and shut those down, because those are getting in the way as well. And usually that's common sense. People kind of know that already. Let's try to find something that goes deeper and fixes it at the root, and then you get a better life.
right.
You don't have to work so hard to manage the symptoms. What you do is you
and then
clear those
you
symptoms.
can revisit in moderation.
Yeah, good, clean fun.
Yeah.
Right?
Have an Oreo there, have an Oreo here.
What doesn't kill you makes you stronger.
Occasional,
Yeah, right. Like that. Like real life. So, let's talk about how to fix the liver.
Uh-huh.
And we are already talking about some of the
We're
basics.
doing diet, we're doing testing, we
There's lots of things that you could have the liver.
are
you
looking
could take.
for infection.
There's lots of things you could take that get the liver working better. A
Okay.
bunch of stuff. And one of the things that's most helpful is herbs. They're particularly helpful for helping livers.
Because they not only treat the liver, but they also treat the system as a whole.
Yeah, there's a lot of complexity to herbs.
Right.
It's not one thing.
Yeah. What herbs do you find best to stimulate the liver?
There's lots of them. We're talking, about 30 different herbs. I don't want to go through them all. I don't want to make this a herb lecture. Let's go through the top 3.
Okay.
They are salibum,
Okay.
milk thistle, which is the same thing.
Chelidonium.
That's right, and Chiananthus.
Okay.
And greater celandine, I think, is what Chiananthus is. And Chelidonium, I only know it as Chelidonium. So it's got some other common name, but it's whatever it is, it doesn't stick in my brain.
I just go by Latin name.
And they work really, because we do everything in Latin here
Yeah.
in the clinic. They work really, really well. They are remarkably effective. They're very dependable on getting liver symptoms, hormone problems, headachy problems, fatigue problems, all that kinkubuto we talked about earlier, rashes, those kinds of things, to get them to clear up
Okay.
based on these liver herbs. If the liver's got something to do with it, these herbs go a long way to help. Bile salts are also helpful. Vitamins in general tend to be helpful. B vitamins in particular tend to be helpful. Magnesium tends to be helpful. There's lots and lots of other things that you can take. That'll go into some kind of general liver tonic, like that. So there's pills you could take that work well. We have a combination formula that we use here a lot. Anyways, that's that. The other thing that works really well is to stimulate the bile to flow better, because bile is a substance that the liver makes to get rid of waste products. Now, it also does double duty because it works as a detergent.
Sure, yeah, it cleans the...
Yeah, and so if you eat something, if you like Dawn dish soap, right? You're trying to break grease. You do a couple squirts on your greasy pan and then rub it something. Wow, the grease is gone, right? It's amazing. Well, we make our own Dawn dish soap in our guts.
And it's bile.
And it's the bile. And what it does is it breaks down the fat. It emulsifies the fat and takes big globs and turns them into little globs. And makes it to where our enzymes can get into those fats, break them down, break down the food that's covered with fat. You eat pizza that's got a lot of grease in it, and so the grease inhibits the enzymes from breaking down the food. So you got to break down the fat first to get to the nutrients, the proteins and the carbohydrates and those things.
Right.
Bile is what does that.
So, based on the modern American diet that everybody is exposed to in this day and age, is there a recommendation of when you should go through a liver cleanse or a certain protocol for a period of time to where you're getting your liver to work into top function?
That's a good question. Okay, so here's how to do it.
Yeah.
Step one, let's take the normal workload off the liver. So now it doesn't have to do anything. All it has to do is just clean itself. Because really it's putting the vast majority of its time and energy resources is going into the process of finishing digestion. So
you don't eat, you fast.
Yeah, just quit eating.
So you fast for 48 hours?
Yeah, 48 hours might be enough. The thing about fasting, it's easier said than done.
Yeah, I tried to do 48 hours and I made it to 26 hours. And then I was like, why am I doing this?
So the thing is, you get hungry. There's that. And also, the people who need the detox the most are the ones that are going to tolerate it the least. Because what's going to happen is you're going to feel sick.
They're going to get low blood sugar. They're going to get achy.
Spacey and achy.
Okay.
Yeah, miserable.
Okay.
Tired, spacey, and achy. That's what happens.
Okay.
It's sometimes sleepless. That's another kind of side effect of this. It makes it hard to fall asleep and do the actual recovery. So it may be that you don't do a full-on fast. What you do is a partial fast. So now your body doesn't have to digest so much stuff, but you get enough calories in your system that's kind of keeping things up and running. So if you want to generate a fast for your liver, what you really need to do is pull the protein out of your diet.
Okay.
Just 100%. Pull all the protein out. Just eat fruits and vegetables only.
For a week?
Yeah.
And
maybe 10 days.
10 days, okay. And I know people like to do juice cleanses.
Yes, that works too, because now it makes it even easier.
Because you're not digesting.
Because you're not digesting at all. It's already broken down.
Yeah.
So you run it through the juicing machine, you take the fiber out of it, all you have is calories and nutrients. And so that's a pretty decent thing to be able to fast with. You drink these calories and nutrients. Now you want to make sure not to overdo it. You want to get just barely enough to function, but not so much that you're full by any means, and not so much that you're pushing your blood sugars up.
And yeah, so how do you then get your fiber to stabilize your blood sugar during that?
You don't. You just don't drink as much.
Okay.
So you're going to sit down and drink a half gallon of juice, you're going to blow your blood sugars up.
Absolutely not. And I'm thinking about these fresh pressed clean juices. I'm not thinking about store-bought juices.
Yeah, and the other thing you want to do is dilute them. Drink them half and half water.
Right.
So you drink them straight, they're too much.
Yeah.
And you want, remember, the solution to pollution
dilution.
is dilution, yes. So what we're going to do is put a lot of water in. So you're going to water, with some juice in it to get some calories in your system. Also a lot of nutrients to help your liver do its job better. And then what you do is you end up peeing. You pee in every half hour or 45 minutes because you got that much fluid going through you. That's how to do it. You're going to get the best results by doing it like that.
Just a flush.
If you ate vegetables and fruit while you were doing this thing, it would still work. It'd slow it down a little bit and make it a little easier, You may have to run it a little bit longer, get as thorough as a detox. You leave the protein in, you're not on a detox. You're just eating. You take the protein out, now you're on a detox. Because your liver doesn't have to process the protein. There's more energy goes in processing protein than anything else that you eat.
And so what fruits and vegetables should they focus on juicing during this period?
The juicy ones.
The juicy ones.
Yeah.
Like the oranges, the apples.
Bananas don't have that much juice on them.
No.
No, not that. Banana juice is not what we're looking for. So oranges maybe. I'd say apples more. And it's vegetables that work particularly good.
Celery.
Yeah. And kale and beets. Though not too much. Beets are just too strong.
They're sweet. They got a lot of sugar in them and fiber.
And fiber. Beets are fabulous. What you want to do is a little bit of beet, lots of everything else. Carrots are the other thing that's really good. I love carrots. Carrots juice beautifully.
Are phenomenal. Yeah. I love carrot juice.
They do a great job. So you can take vegetables to your taste. Also, cucumbers are nice. They have a lot of water in them, and they have a nice taste to them. There's not a whole lot to them, but they're decent.
I like green apple, celery, cucumber, cilantro juice.
Good, perfect. And what I was just going to say, the best way to do this thing is mix.
Yep.
You don't want to do a straight juice. You want to do a mixture of juices. Some colored, some green, and you would definitely want to put some colors in it. The best kind of juice for you to detox on is going to be all the colors of the rainbow all put together, which turns out to be brown.
Yeah, mud. Just mud. But if you want to break them up into 3 different juices a day, then you can have a green juice and a purple juice and then a greenish purplish juice.
There's going to be some orange there.
While we have just a minute longer, are there any closing thoughts you have on liver enzymes?
Castor oil packs.
Okay.
Yeah, the castor oil packs are fabulous. What they do is they cause the bile ducts to constrict and they squirt bile through. And bile is the means by which these toxins are removed from the liver. So if you can increase the amount of squeezing and pumping, if you will, that the bile ducts do, you're going to move stuff out of the liver, and the liver's going to do better. It's going to feel better about it. So castor oil packs, you drizzle castor oil on a piece of fabric, like a piece of flannel.
Cotton or flannel.
Wool even.
Yeah.
And then you put it against your liver, which is here on your right side. And then you put a piece of saran wrap over the top because the castor oil is real stainy. It'll stain whatever it drips on, like a couch. And then you put a hot pack over it or some kind of heating element or just.
How long do you leave it on for?
It depends.
I've heard people leave it on overnight.
You can. I'd say it's too much. I do more of a short amount of time doing it. I'd say 45 minutes, an hour and a half, somewhere around there.
And what's the duration of the protocol? Is it for a week, for 2 weeks, every day for 45 minutes?
For the castor oil?
Yes.
Till you feel better.
Okay.
So I don't know how long it's going to take. Depends on what you got and how much damage there is and how much cleaning you need to do. I mean, you could do a castor oil pack every night the rest of your life and be fine. It doesn't cause any problems. There's no side effects. There's no damage. There's nothing like that. Or you can run it for a week, just to clear up your hard periods. You got this real achy and you got crampy and you got all this other stuff going on.
And would you do that before your menstruation or during your menstruation?
In terms of how to fix this, I would do it between a menstruation. Menstruation, you got enough stuff going on already.
Yeah, you
don't want
enough.
It's not a good time to stir stuff up because everything's stirred up already. There's a lot of breakdown going on. I don't necessarily want to do it then. The best thing to do is to do it when things are calm and quiet in between because it's going to stir stuff up.
So there are
again.
so many different phases. So there's the menstrual cycle, then there's the follicular cycle, then there's the ovulation, then there's the luteal phase.
Yeah, here's the thing. Where you feel the worst, don't do it then. Okay. Do it when you feel the best because you're feeling your worst because you got too much stuff moving already.
Okay.
And your body's overwhelmed. And now you're going to squeeze things and make it stir up? No, this is going to make you worse. You're gonna curse these things. No, do the castor oil pack when everything's hunky-dory and calm and peaceful. Run this thing for 2 or 3 weeks and just kind of clean out then. That way when this stuff gets stirred up, who cares? There's nothing to stir. We already got all that stuff out. We're clean at this point. So you're good, right? Like that. That's how to do it. Okay.
Wonderful. That was a lot on liver function, and I have so many more questions. But
a lot more to say about this whole thing. Lots more. But wait, it's okay.
We'll have to
Just
do
give
another.
everybody a taste, right?
We'll do another liver show in the future. Thank you again, Dr. Luper.
Hey, my pleasure.
Thanks for tuning in to another episode of Sensible Health Solutions. We hope you found today's discussion enlightening and packed with practical tips to enhance your wellness journey. Remember, small changes can lead to big results. If you enjoyed the episode, don't forget to subscribe and leave us a review on your favorite podcast platform. Your feedback helps us bring you the best content possible. Stay connected with us on social media for more health insights and updates. You can find us at Sensible Health Solutions across all social platforms. Until next time, stay sensible and stay healthy. This content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Seek medical advice from a healthcare professional for any medical conditions.